Good afternoon, everyone. My name is Tarnika Manning, and I'm the Community Outreach Manager for the Metropolitan Chicago Breast Cancer Task Force. We are a nonprofit organization that is working to end disparities in breast cancer mortality rates in women of color in Chicago. To learn more about our work, visit our website at www.chicagobreastcancer.org or give us a call at 312-942-3368. You're watching a live call-in television program brought to you on cable channel CAN-TV 21, and we're online at cantv.org/live. During our show, we will discuss various topics around breast cancer and disparities in Chicago. I invite you to call in anytime you have a question. Our number here is 312-738-1060. All right, so today our guest is Angela Johnson. Angela is a practitioner on the Rush University Medical Center Integrative Medicine team. She's going to tell us all about integrative medicine and how it can be useful for cancer treatment. All right, so if anytime you have any questions for Angela, give us a call at 312-738-1060. All right, so hi, Angela.
Hi, I'm good. Thanks for having me. Thank you.
Thank you for coming. All right, so can you just tell us a little bit about your background?
Yeah, so I've been in the field of health for about 18 years, but most specifically working in the area of integrative medicine and on staff at Rush for the last 12 years. I am a practitioner of Chinese medicine with our cancer integrative medicine team, and also involved in some collaborative research with other faculty members.
Oh, good. Yeah. All right. So what exactly is your role at Rush?
So my role at Rush is I'm one of the team members with the Cancer Integrative Medicine program, and I specialize in providing our cancer patients with acupuncture to help offset the side effects of chemotherapy and radiation. And I also incorporate and help patients learn mind-body modalities like breathing and meditation and visualization so that they can be involved in their own care.
Okay, awesome. All right. So can you give us a definition of what is integrative medicine?
Yes. So integrative medicine is the use of complementary therapies. So when I say complementary therapies, I mean acupuncture and massage and yoga used in conjunction with conventional cancer therapies like chemotherapy and radiation.
Okay, good. Okay, so what populations do you usually serve?
So I specialize in oncology. And but I also provide a lot of care for patients from patients who are referred from other specialists.
Okay, all right. So again, if you have any questions for Angela and you're trying to get a little bit more understanding of integrative medicine, give us a call at 312-738-1060. All right. So how does integrative medicine affect or work with the cancer treatment process?
Yeah, so that's a really good question. Integrative medicine is something that really helps a person from a holistic perspective, and so we try to help someone from an emotional perspective, a physical perspective, and a spiritual perspective, because there really is no separation when you're trying to work with somebody, and so that's where our entire team comes into play to try to help people.
Oh, good, great. All right, so why should a cancer patient consider including integrative medicine into their treatment plan?
Yeah, so that's a good question. Studies show that about between 36 to 65% of people diagnosed with cancer make the decision to incorporate integrative medicine into their care. And some of the primary reasons that people do that is because they want to be involved in their own care, which is very empowering. And studies show that when people are involved in their own care, when they are making decisions to do something, they will often recover more quickly and do better overall. And so it's very empowering when people make this decision to do things like acupuncture and massage. It really promotes a sense of health and well-being. People turn to us because they want to lessen the side effects of their treatments.
Oh, great. So someone's been diagnosed with breast cancer. When exactly can they reach out to you?
Yes. At any time that it makes sense. As we were talking earlier, one of your colleagues brought up a really good point that when you're diagnosed with cancer, I mean, it's a very overwhelming process, and there's a lot of information to take into consideration. And so really, it is at any point in time. So at the point of being diagnosed with cancer, or if you're going through treatment, or if you're all done with treatment, whenever it feels right to you to incorporate these therapies into your care is the best time. Everybody is so unique in terms of their own journey with cancer, and when they feel like they want to do these types of modalities.
Yeah. All right. So again, if you have any questions for Angela, give us a call. We're at 312-738-1060. All right. So if someone comes to you after they've been diagnosed, what should they expect at their first session with you?
Okay. So I have the pleasure of being able to spend about an hour and a half when I see someone for the first time.
Oh, good.
And so we spend the majority of that time. I learn about that particular person, and I learn why they're wanting to incorporate acupuncture into their care. And so let's say, for example, someone is coming to see me because they're experiencing neuropathy, which is that really painful kind of nerve knife-like pain that people will sometimes experience as a result of their chemotherapy. So I want to know everything about their pain. I want to know how long when the onset was. I want to know what they've done to perhaps address the pain. I want to know how it is impacting them from just a quality of life perspective. And then because Chinese medicine looks at the body from a holistic perspective, I also then want to know, how is their energy? How is their sleep? I want to know how their digestion is. I want to know, I want to get a full picture of what that person is experiencing, because in Chinese medicine, everything is related. And so I try to get to the root of why this pain is happening from a Chinese perspective. And then I answer any questions that they might have about acupuncture, especially if they've never had it for the first time, because there are a lot of things to know. And I really calm any fears that anybody might have about acupuncture. And then I get them ready for the treatment. The needles get inserted, which takes about 10 minutes. And then if they want and are interested in me walking them through a guided meditation or a breathing, I will then do that. And then I typically leave the room, and they're provided with like a wireless doorbell, so that in the event that they need me for any reason, they can reach me. And music is playing, and the table is heated. It's a really relaxing, a really relaxing experience. And then after the half an hour is over with, I go in, the needles come out, and we chit-chat for a couple minutes, because I want to know, how was that experience for you? And we talk about next steps. And then I will typically follow up with the person the next day by phone. How was your experience? Do you have any additional questions? And, and because we work in very close collaboration with our patients.
Yeah, it sounds like you're very hands-on.
Yes,
Even with the first session.
Yes.
So what is the progression through the different levels of therapy sessions?
Yeah, that's a really good question, because a lot of patients want to know. They want to know, well, how many treatments is it going to take to address my particular we used pain earlier. So how many treatments is it going to take for me to experience a reduction of pain? Everybody is so different, right? And so what I typically use as a guideline is kind of keep in mind the importance of coming to see me once a week for about 6 to 8 weeks. However, at every treatment, we will address together and assess how someone feels like they're doing, and I will share with them, well, this is a very typical response to acupuncture, and then we make a decision together, which is really nice. Instead of me saying, you need to see me, blah, 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 it's a collaborative decision-making process, which is really nice.
Great. So again, if you have any questions for Angela, you still have a couple questions about acupuncture or integrative medicine, give us a call. We're at 312-738-1060. All right, so who exactly is a good candidate for receiving integrative medicine treatments?
Yeah, so again, I feel silly saying this. It really depends on the person. I mean, someone who is interested in wanting to be involved in their own care is a really good candidate. Really, anybody during the cancer journey can really benefit from the services that we provide. And I have to tell you that I have provided thousands of treatments, literally thousands of treatments, to hundreds of people of all ages, the youngest being 8, the oldest being 94. And the impact of acupuncture on our patients still blows me away as a provider. And it can make such a significant difference in the lives of our patients. And sometimes it's the silver lining that helps people get through their treatments. It really is.
So it can be more than just pain. It can be stress or anxiety or...
Yes. And so some of the biggest benefits that people typically experience from acupuncture is I will often help to address side effects like chemotherapy-induced hot flashes, neuropathy, which is that nerve pain that we were talking about earlier, nausea and vomiting, certainly from more of an emotional side of things, the anxiety, depression, irritability, and anybody who's going through radiation, acupuncture is really good to address xerostomia, which is the technical term for like dry mouth.
Okay.
So those are some of the big players that we can address.
Okay. All right, so those are the major outcomes. Any other major outcomes that you see from acupuncture?
Yeah, the other thing too, pain from either the cancer treatment or the cancer itself, and also chemotherapy-induced fatigue.
Okay.
So what ends up happening is that we reduce the side effects of the chemotherapy, and sometimes, and this is only done in collaboration with physicians and their healthcare team, but if we're able to reduce side effects of their treatment, sometimes people are able to take less medications. Certainly, only in conjunction with their physicians. But then, as a result of a decrease of those side effects, we see an increase in someone's feeling. You know what I mean? Feeling a better sense of quality of life. And when you're not as fatigued and when you don't have as much pain, you're going to feel better emotionally and spiritually. So it really can make a significant impact.
Great. So one of the things I know people probably ask is, when are they going to start seeing results?
Yes. That is probably the most common question. So I appreciate you asking me. And again, it really varies from person to person. The most important thing, if someone is going to make the commitment to taking the time out of their busy week to come to Rush for integrative medicine services, the thing that they need to remember, especially for acupuncture, is that receiving treatments on a weekly basis is really, really imperative. So you have to think about acupuncture like a dose of medication. And there ends up being, and there can be, an accumulative effect of the treatment. And so we typically see if someone is experiencing and coming to see me for pain, we typically see a reduction in the pain intensity. So if someone is coming to see me and they initially have a rating of 8, we see that typically decline over a series of weeks. The duration of time, if someone's in pain for the majority of the day, they begin to say, Angela, I feel like I'm not in as much pain as much of the day anymore. And then we see positive side effects from the acupuncture, where people are saying, geez, I originally came to see you for pain, but I'm noticing that I'm sleeping better, and I feel like I feel like I'm just feeling better emotionally, and my digestion is better. So the side effects from acupuncture can really be very positive.
Oh, that's really great. All right. So what are some misconceptions people may have about integrative medicine?
Yeah. So the thing about it is that, and this might be more from a from a physician standpoint, maybe not necessarily from a patient standpoint, is that sometimes people will come to see us when they've tried everything else, when they've tried all sorts of medications and none of that has worked. Then we finally see them, and one of the things that we try to tell patients and tell our physicians and tell our nurses is that it's really important that people try to see us much closer to the time of diagnosis and much closer to the time of when they start treatment, because oftentimes we can try to help prevent side effects from happening in the first place. And so don't wait. So one of the biggest misconceptions is wait until you've tried everything else.
Yeah.
And the other thing is in particular with acupuncture, I think one of the biggest misconceptions is that, it is going to be so extremely painful and you're going to have needles all over the place. And that's not necessarily the case. I know that a lot of times people think of like needles and they think of the needle draw.
Yeah.
I am an acupuncturist. I use needles. I hate getting my blood drawn. I do not like getting my blood drawn. But acupuncture needles are extremely thin. They're hair thin. And sometimes you can barely feel them being inserted into the skin. And a lot of times people find the treatment actually, ironically, so relaxing that they will often fall asleep during the treatment. And even the kids that I provide care for find it relaxing. I did a study that looked at the role of acupuncture in our pediatric patients for pain. And both from a parent's and a patient's perspective, they found it to be relaxing and help to improve quality of life.
Okay. All right. So what questions should a cancer patient ask before beginning an integrative medicine program?
Yeah. That's a really good point. So the thing about it is that it's really important to, just like with any provider that you're going in to see, number one, it's really important to, perhaps call them up on the phone or make an appointment to have a consultation to see if there's that connection, because you really, this is a really critical time, during your life. You're being diagnosed with cancer, and it's going to be, an interesting journey where there are a lot of things to do, and you want to make sure that your team is composed of a group of people that you totally trust. Yeah. And so having that connection, I think, is imperative. Also making sure that someone has the appropriate training and credentials. Yeah. So in acupuncture, it is a 4-year full-time master's program that we go through, and then we're credentialed nationally, and then we also receive our license from the state of Illinois. Okay. So making sure that they have the appropriate training credentials and education.
Okay. Yep. All right. So once again, if you have any questions for us, give us a call. We're at 312-738-1060. All right. So how can someone find a reputable practitioner?
Yeah. I think it's always advisable for patients to ask their healthcare providers who they recommend and who they refer their patients to, which is good. I think then also patients, and this is what we see, not only what I see with my patients, but what we read in the literature, is that patients will often ask family members and friends, which is good to get a referral. And then to make sure that someone has the appropriate credentialing, if they have access to a computer, they go into Google and type in NCCAOM, which is our national accreditation board, to find a provider in your area.
Okay. So what's those initials again?
NCCAOM. Oh,
great.
Yep.
So definitely, if you have any questions after the show or you want more information about practitioners, definitely check out that website so you can get some information about that. All right. So you mentioned before that it's a 4-year degree, but how can someone get started in a career as an integrative medicine practitioner?
Yeah. So it really depends on what your area of interest is. I mean, in integrative medicine, you could go on to be a massage therapist, you could go into yoga, you can go on to be an acupuncturist. And that's just to name a few of many. But it really depends on where your passion lies first and foremost. And then you should look into the different programs that are available and what prerequisites you might have to have in order to go through the training. And then and then I always recommend that before you start a program is to call people in the field who are doing it. What is your day like, right? What is a day?
Shadowing, that's also a good idea. Yeah.
Shadowing, yeah, absolutely.
Yeah.
So I think that's always a good recommendation. And then going in and getting maybe a treatment from them, I think is good. And then, once and making sure that you've left no stone left unturned, then I say apply and go for it.
All right.
Yeah.
So what are the needed credentials and accreditations for your acupuncture?
Yep. So you have to have a master's in, I have a master's of science of traditional oriental medicine.
Okay.
And from an accredited school here in Chicago, of which there are about 85 schools in the country.
Oh, okay.
And then I had to become nationally board certified through the NCCAOM. And then I had to also become licensed in the state of Illinois.
Okay.
Yeah. And then I'm credentialed at Rush then, to be able to provide my services for our patients, both inpatient and outpatient.
You have a lot of initials behind your name.
I know.
I know there's a lot of accreditations and credentials you have, so that's pretty much the typical process. That
it is.
Yeah,
it is.
So if there's any students out there thinking about a career path, definitely look into it.
Yeah. Yep. Very good.
All right. So how can someone get more information about your Rush Cancer Integrative Medicine Program?
Yeah, so they can certainly give our office a call, which is 312-563-2531, or you can go online and you can type in Rush University Medical Center, and then you can just Cancer Integrative Medicine Program.
Okay. Or you can Google Angela.
That's right. Angela Johnson, Acupuncture, Chicago.
That might be just enough leeway you get.
Yeah.
Also, I know we were talking earlier. You were saying that you don't have to be a Rush patient to come see you.
Not at all. Not at all. Yes, we see patients who are being treated from other institutions as well, and we welcome any and all people who are interested. We have a really great team of very talented, very passionate people who really are there for you. And so, I'm blessed to work with the people that I work with, and we are all honored to be part of our patients' journeys during such a significant time in their life. So, yes, feel free to call us and ask us questions and come in and have a consultation and just get to know us.
And then if someone comes from a different facility, you guys will connect with the other.
Yes, and thank you so much for bringing that up. So it is, we very much work in very close collaboration with a patient's healthcare team, and so we will be in touch with and communicate with and follow up with that patient's providers to let them know how they're doing and making progress.
Good. All right. So is there anything else that you would like to share with the audience?
No, if... I really encourage, if you've never considered incorporating any of these therapies into your care, I would really welcome you to think about it, and because it can make a really big difference in your health and well-being. And so if you have any questions, certainly give us a call.
Yep. What's the number again?
312-563-2531.
Or you can Google Angela Johnson, Integrative Medicine, and she should pop right up.
Yeah.
All right, I want to thank you for being our guest today.
Thank you so much.
This is a lot of useful information,
thanks.
and we will definitely use your information as we work with women in the city of Chicago and share this great information resource for them. All right.
Wonderful.
All right, and then definitely, if you have any questions about what we do at the Metropolitan Chicago Breast Cancer Task Force, you can give us a call at 312-942-3368, or come to our website, which is www.chicagobreastcancer.org. Give us a call if you have any questions about today's show or what we do at the task force. I'd like to thank you for watching, and please tune in next month when we'll be back on CanTV 21 or online at www.cantv.org/live at 5 p.m., where we'll be here to discuss the latest information around breast cancer and other related issues in Chicago. I am Tarnika Manning from the Metropolitan Chicago Breast Cancer Task Force, and I want to thank you for watching. Have a great day.